আৰু এই মুহূৰ্তত প্ৰিয় দৰ্শক আমাৰ সৈতে আছে Nick Humphreys. Nick, I would like to introduce our editor-in-chief, Mr. Ajit Kumar Bhuiya. Sir, Nick Humphreys, apni gom paise etia.
Welcome to our studio.
Thank you very much. Thank you.
All
Pleasure
right.
to meet you.
So now that we are talking about international medium and also healing, so অজিতা আপোনাৰ পৰা জানিব বিচাৰিছোঁ ছাৰ আপোনাৰ পৰা যে তেওঁ যিহেতু কৰি আছে ইণ্টাৰনেশ্যনেল এটা মিডিয়ামৰ জৰিয়তে তেওঁ কানেক্ট কৰে স্পিৰিটৰ সৈতে গতিকে আমি অলপ আগতে দেখিছিলোঁ বিৰতিৰ আগতে তেওঁ কানেক্ট হৈছিল তেওঁৰ স্পিৰিচুৱেল গুৰু তেওঁৰ ছাৰৰ সৈতে গতিকে আপুনি যদি কিবা জানিব বিচাৰিছে এড অন কৰিব বিচাৰিছে
First of all, actually, for me, it was very difficult to believe the existence of spirit.
Okay.
So, if it's a question of faith, then there should not be any argument, of course. But you'll have to convince me, now. How will you convince me the existence of spirit? That's the question.
Okay. So you want me to? I'm not here to.
Don't mind.
I'm not here to convince anybody. Okay. I'm just here to convey messages of love from spirit world. Okay. But I want to tell you, okay, that even when you were sitting in the corner in the studio, and even when you're here, I see a gentleman stand next to you. Okay. A very proud man. Okay. Very proud of you. He tells me that actually this person would be your father. Would you understand this? Or if it's not your father, it would be your grandfather. But he stands on your father's side of the family. So do you understand this? Yes?
Yes.
Okay. Now, he also tells me here, okay, that before his passing, he had difficulty breathing. So would you understand this? So I believe it's your father, actually. He tells me that he had difficulty breathing. And he's making me go like this. So this would mean that there was some sort of problem with the chest area. Do you understand? Okay. First and foremost, I want to tell you that how much he's proud of you and how much he loves you. Okay.
My father.
Your father. Okay.
He loves me. He died 40 years back.
Okay. Don't give me any information. Okay. We have a saying when we do this job. Okay. Don't feed the medium. Okay. Because we're full up with information. Okay. But your father is coming forward to convey this loving message to you. He tells you, actually, I know you're a very busy man, I can tell, okay? But he is telling me that you're a very busy man. Okay, thank you very much. Now, before I go on, let me tell you that I do talk out loud to spirit as well, because it'll build up the energy between us, okay? Okay, my friend, thank you. Right, so let me continue, because he's talking about how busy you are, okay? But he's saying to you, it's also time for you to relax a little, okay? And enjoy what you've got, what you've become. Okay, right. He's talking about your family because you have a lovely family, but he also wants to talk about your mum. Okay, because I believe your mum is still here. Okay, but your mum is also struggling a little bit. He says, would you understand this? And he comes forward to not that you'd understand, but he comes forward to give her a bit of help, a bit of love. Okay. Okay. Now he's given me an impression here that your mum sometimes cries as well. So your mum's very emotional also. You understand this?
Yes.
Okay. 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 I know he's saying it's because she misses me. Okay. We know this. Okay. But I think there's something a little bit more with this. Okay. So let's talk about you. Let's see if he can give you a bit more information about him and about you. Okay. Say again. Right. Now, he's talking, sometimes what they can do is they can give evidence of things that were given, okay, as a gift. He's talking about a watch, okay? He said, I want to also mention or say thank you about the watch. So is it that you gave him a watch or there is some sort of gift of a watch? Would you understand this?
Yes.
Okay. And this is quite a good memory for him, okay? Okay, so again. He wants you to know that I know the watch is still here in the physical, but he wants you to know that the watch is still, he wears the watch in the spiritual as well. Okay, give me a bit more. Okay, thank you, sweetheart. When I actually look at him and he stands actually beside you, okay, I would say actually he's very similar to your height, your father, okay? Right, thank you. But he tells me that even though you look like him, you have your mother's eyes. That's what he's saying. When I look at him, I can see it very much the same, okay? Right, thank you. Right, but he also wants you to know that he's well, he's safe, and he has no pain because he tells me there was pain. And he also tells me very quickly that he passed quickly. Okay, so you understand that?
Yes.
But he wants you to know that he's also met up with his mum and dad. He tells me his mum and dad are also in spirit. You understand that also?
Yes.
Anything more? Okay. He wants to know what?
Nothing about my father. Actually, it is true.
Do you understand all this information that I'm saying about your father? Okay. How does it make you feel that I'm linking to your father?
Yes, I feel very emotional.
Okay. Say again, sweetheart. Okay. Now he's also saying thank you to you. Okay. Because right. Thank you very much. I'll offer that. He's saying thank you to you for two reasons: for helping him, but more so for helping the family. Because you have given a lot to the family. A lot of your time, a lot of effort has gone into the family. More so around your mum, he says. Okay. Okay. Thank you. Now, is it right that your mum has also been a little bit sick? Okay. He wants you to know that actually she's going to be okay. Okay. Anything more? Okay, my friend.
About my mother.
Your mother.
Mom.
You want to know about your mother?
Mom.
Okay, a little bit more about the mum, please. Okay. He's just saying that she's okay. Okay. So your mum. Okay. Second. Right. Okay. Right. Then I'm okay. Thank you very much. What he's saying is, I can't see your mum. Is your mum in spirit?
Yes.
Okay. Because I can't see your mum at the moment. He's actually the stronger of the two at the moment. Okay. But I know that your mum is well. Okay. Say again. Thank you. But he said that she did suffer also. You understand this?
Yes.
She suffered. Okay. But there is no pain. Okay. Again, anything that she had on the earth plane is no longer with her in the spiritual. Okay. Say again. Right. Right. Okay. Thank you. But they both want to tell you that they love you. Okay. First and foremost, that's what they come forward to tell you. Keep up the good work, they say. Okay. Your dad. When I link to and talk to your father, I get a very proud man, as I said before, but also a jolly side to him. You know, he was a very happy man, and he just said, "Yeah, I loved life. I really did love life." He enjoyed everything about it. But your mum was the worker, he said. Mum was the hard worker, so she kept everything going on in the family. Okay. Anything else you want to say?
Now you told me that my eyes are like my mother's eye.
Yes.
It's true.
Yes. Okay. So so bless your heart. Okay. So how I always finish with a link from Spirit is by saying to you, please take the love from the Spirit. Okay. Your mum and father are around you all the time and around your family, and you also about your children as well. You have great children. Okay. But please take their love, and I'll ask them very kindly just to step back into the spiritual world. Okay. And my friend also will help them pass back into Spirit. Okay. So thank you for letting me having the opportunity to bring them forward for you. Okay? Happy with that?
Yes, exactly.
Yeah?
Okay.
Nick, thank you so much. Sir, আমি দেখিলোঁ কি হ'ল ষ্টুডিঅ'ত এই মুহূৰ্তত, গতিকে আপোনাৰ প্ৰতিক্ৰিয়া জানিব বিচাৰিছোঁ, যিহেতু কানেক্ট কৰিলে স্পিৰিটৰ সৈতে নিকে আপোনাৰ লগত, চ' তেওঁ এজন মিডিয়াম আছিলে, আপোনাৰ প্ৰতিক্ৰিয়া জানিব বিচাৰিছোঁ যিহেতু
আমাৰ জীৱনৰ বহু অভিজ্ঞতাৰ মাজত এটা এক বিচিত্ৰ অভিজ্ঞতা। এনেকুৱা স্পিৰিট সম্পৰ্কীয় কথাৰ আগতে অলপ চলপ অভিজ্ঞতা নোহোৱা নহয়, কিন্তু আজি এই অভিজ্ঞতা খুব স্মৰণীয় হ'ব আৰু মনত ৰাখিব লাগিব, কাৰণ মোৰ আজি বহু বছৰ আগতে মোৰ দেউতাৰ মৃত্যু হৈছে, মাৰ মৃত্যু হৈছে পৰৱৰ্তী কালত। তেওঁ যিখিনি কথা ক'লে, মই নকওঁ যে গোটেই কথাখিনি একেবাৰে সম্পূৰ্ণ শুদ্ধ, আৰু এইটো নহয় যে মোৰ কাৰণেও বহুত স্মৃতি এতিয়া লাহে লাহে মানে যিটো ফেড হৈ গৈছে। গতিকে কিন্তু কথা যিখিনি কৈছে, মূল কথাখিনি তাৰ সত্যতা আছে, গতিকে ময়ো চাগে এতিয়া লাহে লাহে কথাবোৰ ভাবিবলৈ আৰম্ভ কৰিম আৰু বিশ্বাস কৰিবলৈ আৰম্ভ কৰিম।
ঠিক আছে, আমি আৰু আপোনাৰ সময় ল'ম, কাৰণ নিক কেৱল হিলাৰো হয়, কেৱল মিডিয়ামেই নহয়। চ' নিক, ইউ আৰ অলছ' এ হিলাৰ, ৰাইট? চ' উই উড অলছ' লাইক টু ন' এবাউট দ্য হিলিং প্ৰেক্টিচেছ ইউ ফ'ল' অৰ ইউ আৰ হিয়াৰ টু।
Okay. The healing that I do is a physical healing. I call it trance healing. And it's an allowance again for a spiritual doctor to enter my body and to perform what I would only call an operation on the individual that I'm working for. And Dr. John, which is what his name is, was around on the earth plane in 1826, which is where he started his career. He worked for a hospital in Sheffield, United Kingdom, called the Royal Infirmary. And he then furthered his career by moving to London and worked for the Royal London Hospital. We believe also, from the understanding from him, that he actually was a royal physician. So he's quite a high standard doctor, but he doesn't work alone. So when he comes forward through me, he also brings a team of doctors and nurses to convey like an ordinary operation. So you have nurses and doctors taking blood pressure, bloods itself, and also looking around the body to see if there's anything else they can do.
Mhm.
So they all have their own little specialities, but it's a hands-on healing.
It's a hands-on healing.
it's a
No
hands-on.
surgical thing can be, obviously, practically speaking, can't happen. However,
course.
it's a hands-on healing.
Yes.
You mean to say, wait a minute, just a few minutes ago, you just said that the doctor enters the body.
Yes. So like my good friend and guide Tuhawk, he also enters my body.
So can we see that again?
We will do. Let me. Can I just explain a little bit more about how
sure.
the process is? Because
Sure.
people say when they hear the word operation, they think there are, as you say, it's not possible to have a knife or a scalpel or implements going into the body. So what happens is that my hand will be placed onto the body, but his hand will work through mine and then work underneath, and then he can work around into the body. So he's actually able to put things in the body that won't show up on the X-ray, but will help to assist. So somebody that has a bad back, he's able to put a brace in around the spine to help the support. The same with any joint, knee, elbow, and the foot and the ankle. So, but you'd like to meet Dr. John.
Right. We
Yes,
would like to
yes.
meet Dr. John, and we would also have Arso with us, so you can, of course,
I am
Okay.
the
take him
patient.
as the
You're the
subject.
patient.
You
Yes,
can
I
take
am.
him as the subject, right?
I have all diseases. From where I'll start?
Okay, but also what happens is that after the initial healing is done, half hour, 15 minutes, an hour, the healing that happens, they continue to do the healing for another 3 or 4 days after, even 5 days after. How they do that is when you're sleeping at night, they will come to you and they will work on your physical body to give you healing. We also do absent healing. So when I'm at home relaxing, I get a phone call from my dear friend Chinmoy and asking if I could do healing for his mum or a friend. So what I do then is I ask my spiritual doctor to either send himself or one of his team to go and help that person. If I see an ambulance drive past with the alarms going, the signals going, I ask Dr. John to send somebody with that ambulance to help that person. So it's all unconditional love. I see peace and humanity within all. So
গতিকে সো আপুনি মানসিকভাৱে পুৰা প্ৰস্তুত নে কাৰণ এই হিলিং প্ৰচেছ দীঘলীয়াও হ'ব পাৰে
দীঘলীয়া মানে
এওঁলোকে যোনটো কৈছে যে আপুনি শুই থকাৰ সময়তো মুহূৰ্ততো হৈ থাকিব পাৰে বা 3-4 দিনলৈকে এই প্ৰক্ৰিয়াটো চলি থাকিব পাৰে
There's no problem.
okay. Once again, what I need to do is I need to take off
If
my
I
glasses.
get relief, then it's okay.
Okay, so I need to take off my glasses, and I need to ask him to come forward. But I'm very drawn to your legs for some reason. Do you have problems with your legs?
Yes.
Okay.
Now I'm been suffering from a trinitis. They call the disease trinitis.
Yes.
There's a sound ringing in the ear,
Okay.
the right ear.
Okay. You may need
It's a
to.
major
Okay.
problem.
I may need to stand up and stand behind you for this.
And after that, pain here and lumbar.
Okay. Okay. What we do, the healing will actually go through the whole body. Okay. But when we do the healing, if it's the ears that we're having the main problem, then it would be more direct for the ears. So he'll put his hands over your ears. For the back, we need to put the hands on the back. But I think for this purpose, we'll work with your ears for you because that's making you quite dizzy as well. You understand this? Okay, so we need to get that working for you. So but I will need to stand up and work behind him. Okay?
Okay.
Do you need to stop?
Do you want him to come at the center so that it will be easier for you to practice?
Let me ask him. How do you want me seated, DJ, or do you want to be? You can stand behind him. Okay. So if he moves forward, is that okay for you? And I stand behind him?
Yeah.
Yeah, that's fine.
All right, Nick, our editor-in-chief is here as the subject, as
Yes.
the main subject, and he has some problems and disorders, as you have mentioned.
Yes.
And as he has rightly mentioned, so Nick, it's all up to you now. You can call your doc, your friend, so that he can heal.
Okay. So what we'll do, the first process is I'll put my hands on his shoulders, and I'll ask Dr. John to come forward, and then he will go to the area that's needed. He knows he's got to go to the ears, so we'll begin. I'll allow him to come forward.
Sure.
Okay.
welcome doctor to the studio.
Yes. Hello, my dear.
Yeah,
Yes.
he has some problems, and so you might have seen, you might have prognosticated. So would you like to heal him?
Of course, my dear. Yes.
Sure.
So what we're doing, I've actually brought 4 of my team members with me.
Sure.
Okay. And what I mean by that is that I have a couple of doctors and a couple of nurses, just making sure all the procedure, what we're doing, is correct. He has an inner ear problem. So what's happening is his stability isn't as good. So in our ear we have these little bones and they vibrate. Okay, so they obviously you have the eardrum itself, but the bones aren't working as well as they should do. So we're going to actually, dare I say it, but we're going to take them out slightly. We're going to give them a clean, and then we're going to put them back in, and then the vibration will be a lot better, and hopefully the actual balance in himself will change. You also have a tube which runs from the very ear to into the throat. It's a drainage tube for any build-up of mucus or anything like this. So what happens is sometimes this gets blocked also. So we're going to give both ears a jolly good clean, okay, and make sure everything is working well. He may feel things, he may not feel things, but he may do. Okay, so let's just proceed.
Sure.
That's what we're doing at the moment. Okay, so we're in a studio. So would you like to ask any questions?
How long have you been practicing like this?
Oh dear, that's a good question. 1826 is when I started my profession.
All right.
I know Nick sometimes offers the information that I was born in 1826. I wasn't. I was born a little bit time before that. But 1826 was when I was a doctor in the Royal Sheffield Infirmary back in the United Kingdom. I continued to grow with my profession. I read a few things for a few medical journals, and then I decided and was actually invited to work for the Royal Physicians and the London Hospital. So where I worked with things like broken bones, muscles, etc. But generalized medicine with the body.
All right, so and besides that, I would also like to know, since you have started your profession way back in 1826, so how long, it's been like years and years now.
Yes.
How many patients have you cured? I guess it's like innumerable.
Yes, it's uncountable. Uncountable. Nick is also constantly asking me to go to different places to do some healing across the world. Obviously, we're spirit, so we can travel as far as quickly as possible. But yes, the medicine itself hasn't changed that much. The techniques, however, have, and we continue to develop within the spiritual world. Again, I need to explain this also. So when sometimes, depends on your belief, of course, that when you pass the spirit, you can do whatever you like. You can learn law, you can learn medicine, which a lot of people do, to become healers themselves. And we can develop things, techniques that are then passed on to the actual physical doctors on the earth plane. It takes a little while to come forward, but it is possible, and we have done it with great success.
Okay, so shall we start now?
I've been working since we've been talking, my
Okay,
friend.
and we have been chatting and working.
Yes, of course.
So also another question, if you don't mind, would you like to cure me as well if I come to you someday?
Of course. I'd like to cure anybody of any ailments or issues that they have. The emotional issues are somewhat different, so maybe a different step or a different pathway would be needed for emotional. But we can work alongside all conventional medicines, and we can certainly help with all ailments, physical, mental. So it's not an issue. But yes, of course.
Thank you so much. And how long will this procedure take now?
Okay, I've been indicated I've only got 5 minutes, so we're going to do this quite quickly. So we're actually the vibration has started in the ear already. So we're actually putting the actual bones back, but some issues can take a lot longer, an hour. There have been instances where we've actually had to spend 2 hours with a client because it depends on the issue itself. If they're actually life-threatening conditions, we do spend a lot longer, and we bring along with a larger team with us as well.
All right. And does he need to take any kind of precautions after this process?
He will need to drink some water. He may feel somewhat dizzy afterwards, maybe, okay? Not always, because it's like a renewed balance, but a little bit of rest also, but really because it's the ears, just some water and a little bit of relaxation.
All right. Thank you so much.
So, but we are nearly very finished. So, okay, you'll hear me talking because I'm actually talking to the team. So I'm just asking him just to do a couple of procedures before we step back. Okay. So do you have any more questions, my dear
How many
friend?
team of members you have? I mean, like how many members are there in your team?
Yes, we started with 4. Okay, but because of the growth of the need for the healing and the healing that we offer, we went to 36. Okay, but now we have about 64, but it's growing. We have also an external team, which is a team that I'm able to allocate to different areas. So if all 64 were with me today, I'd still need to be able to send other doctors to other places to continue the healing. So.
All right. And does he need to practice this healing process 2 or 3 more sittings, in 2 or 3 more sittings, or a single sitting would do?
Yes, jolly good. Yes, okay. Initially, yes, it would maybe some instances it would take 1 or 2, maybe 3 sessions. There have been periods where a longer course will be needed, but the initial healing. So even today, we're only doing 5 minutes on this lovely gentleman here. But the initial healing, we will continue doing the healing for the next 3 or 4, maybe 5 days by coming to this gentleman's while he sleeps and performing the same procedure. We do exactly the same just to make sure everything is working as it should do.
Thank you. Thank you so much.
Okay, just need to make sure we're finished. Okay. Is the gentleman feeling anything inside? Would you like to ask?
You feeling something? কিবা অনুভৱ হৈছে নেকি? কিবা অনুভৱ হৈছে নেকি? Vibration.
পোৱা নাই, মোৰ শব্দটো আছে, ইয়াৰ শব্দ হৈ থাকেতো কণ্টিনিউৱাছ ৰিংগিং আৰু গোটেই বডি মানে এইটো পেইন।
এতিয়া ফিল হৈছে নেকি পেইনটো?
এতিয়াতো একো তেনেকৈ ধৰিব
Okay.
কিবা এটা চেঞ্জ এটা লাগিছে।
He can feel a bit of change. However, the ringing of this ear, or might be the eardrum, I may not be correct with the term.
Okay.
He can feel that it still persists, and the pain in the back lumbar area. He has that pain.
Okay. Well, we're not here to give pain. We're here to take away pain.
Right.
So what we'll do in this instance is we're able to put some anti-inflammatory into the actual ear itself, into the eardrum and all the muscles around the ear. Okay. So this will soothe the pain. Sometimes, because don't forget, he's having an operation. Okay, so when you have an operation, of course there's going to be a little bit of pain, but we try to work against that. Okay, we try not to give that. So if he has pain, it should subside within the next 2 or 3 hours. Okay, I do believe we are finished at this moment. Okay, so any more questions?
No, thank you so much for giving your precious time. Thank you so much, sir.
You're welcome, and thank you for allowing me to come forward and offering some healing.
Thank you.
Thank you so much.
Okay.
আচৰিত হৈছে নিশ্চয়, কিন্তু এয়াই হৈ আছে প্ৰাগৰ ষ্টুডিঅ'ত এই মুহূৰ্তত। আৰু এতিয়া আপোনাৰ পৰা জানিব বিচাৰিছোঁ, যোনটো হিলিং প্ৰচেছত আপুনি গ'ল 5 মিনিট সময় তেওঁলোকে আপোনাক হিল কৰিলে, আপুনি কেনেধৰণৰ কিবা চেঞ্জেছ বা কিবা ফিল কৰিছে?
লাইক চেঞ্জ এটা মই ফিল কৰিছোঁ, আৰু কেইবাদিনো এইটো হৈ থাকিব বুলি তেখেতে কৈছে। গতিকে দেখা যাওক কি হয়, লেট আছ হোপ।
থেংক ইউ ছ' মাছ ছাৰ, আপুনি আহিলে ধন্যবাদ জ্ঞাপন কৰিছোঁ, কাৰণ মূল্যৱান সময় দি আপুনি আহিছে ষ্টুডিঅ'ত।
ধন্যবাদ মই জনাইছোঁ। ইটছ এ গ্ৰেট মমেণ্ট and cherish the memory forever. Thank you so much. Nice meeting you.
Well, thank you so much, Nick, for giving your precious time. But before we wind up, we would also like to know this query, a very common question that always erupts, and that is rebirth or reincarnation. If we talk about rebirth or reincarnation, in which most of the philosophy books do believe in or do practice into,
yes.
If there is rebirth and reincarnation, if the deceased person gets back into life in due course of time, then how comes spirit?
Okay, well, I, for one, believe in reincarnation because I know that I've had past lives, okay? But the only way I could do it is by explaining it this way. If I was to pass to spirit, okay, my spirit will be in the spirit world, and then somebody like me can connect to that spirit, okay, and give evidence and guidance as we do. When it's my time for reincarnation, a new self will be born, okay, into a new body, a new life. But what will happen then is an old self will remain in the spirit world. It's like a carbon copy of my old self will remain there for anybody to link into and get information from. So I believe in reincarnation.
You believe in reincarnation.
Yeah.
Okay. And before we wind up again, how do people, whoever are watching at this point of time, whoever are watching you at this point of time, they connect with you? You have your website, you have your, connecting any medium.
Yeah, I'm on Facebook, International Medium Nick Humphreys. I've also got my own website, which is www.nick-humphreys.com. And they can get me on Skype, which is also all the information is on my website. They can contact me via Skype and ask me questions, or email, which is info@nick-humphreys.com.
All right, you can be a medium, you can be a healer, but you cannot foresee a person's future.
We're not a fortune teller, but we can give guidance on those matters that are at hand, and they can give a time scale. So if you was to ask, or if information was given about a business venture, for instance, they may tell you it will take about 6 months to a year. It's a time scale, but we have to remember that we are all given free will. So I have free will to do or any choice that I have. So if I was invited somewhere, it's my choice then to go or not. So therefore my path is slightly changed a little bit. But no, we can't tell you the future.
All right, thank you so much. So I asked you before we started, right in the moment when we started this program, that do you see ghosts around you or spirits around you? Do you think I have spirits around me? Or if I asked you to invite one of my person who has deceased, so do you think you will take an initiative and do that needful?
I don't see anybody around you at the present, because again I haven't opened up the doorway to the spirit world. Okay, thank you. But if I was to say to you that a lovely lady would come forward for you, okay, from the spirit world, okay, I want to go to your mum's side of the family, but I feel this is an older generation, so if it's not your grandmother, it could be your great-grandmother. Okay, I don't know if you would understand that. So do you have a grandmother on your mum's side that is in spirit?
My grandma is alive, my maternal grandma is alive, but then their parents are not alive.
Okay, and this is a prime example, okay, of somebody that you may not know, okay? This is a great-grandmother that works around you. She actually gives you a lot of strength. And people ask me about guides quite a lot. You know, do I have a power guide? Do I have someone like Two Hawks? You know, our main guides are our loved ones that are in the spirit world. This lovely lady that steps forward tells me that she would have passed quite quickly to spirit, but she is always around you to look after you, to give you the strength. And this lady is also quite funny, which is where you get your funniness from, your personality, your bubbliness from. And she tells me this runs through the family also, okay? I have to tell very quickly that there is, again, lots of love to you, and I'm being told that you do a great job. And I'm also being told that, dare I say it, but there is further prospects in the work that you do. And I'm talking, when she says further prospects, thank you, she just said further afield. So this is not going to be just stationed, if you're going to continue this work, it will be elsewhere as well. Okay, but I'm not talking just India, but further afield. Okay, I know I'm not a fortune teller, but she's talking about maybe other countries. So again, you've got to keep your options open. She just said, this lady is very, very graceful, very loving, and you can ask your mum about this lady. Okay, but she comes forward with lots of love and admiration for you.
Thank you so much.
Okay.
Thank you. Well, thank you so much, Nick Humphreys. You came here, you gave your precious time. We were like really, I won't say it entertained, but we were like really delighted you were here, and you actually showcased a total different world altogether. Thank you so much.
Thank you.
Thank you.
It's a blessing. Thank you.
Our প্রিয় দর্শক এই আছিল আমাৰ এই ব্যতিক্ৰমী অনুষ্ঠান। পিছে জনাবলৈ নাপাহৰিব কেনে পালে এই অনুষ্ঠানটি চাই। ধন্যবাদ।